2004, after our third child had been born, Gloria, God called Debbie and I to adopt. And after a long wait, He brought Katherine to us.
We got the phone call that a little baby had been born the day before. They told us over the phone the list of heart defects that Katherine had, and they were very thorough.
One of her ventricles was basically non-functioning or not all there. She had vessels that were reversed and some holes here and there, but all of her defects were balanced within her heart. So it was kind of a blessing the way she was put together.
Katherine was 17 days old when she came home to us, and our children have been an integral part in her care from the beginning.
We have Paul, who's almost 16, Lily at 14, Gloria is 11, Katherine is 6, and Peter is 4. The 3 older children knew that somebody new was going to be coming in, and then once we got closer to Katherine coming home, they knew that there were going to be health issues. They prayed with us, they worked with us, they worked with Katherine. They were just super kids.
She was so teeny, and because of her defects, we remember it was a struggle to get her to finish a half-ounce bottle. Just the physiology of her heart made it difficult for her to operate on a normal basis. But yet, she smiled, she ate, she slept, she cried. She was a perfectly normal baby, except for what was unseen. Before we were able to bring Katherine home, we had to have her pediatrician and her cardiologist lined up, ready to go, before we could go through with the adoption papers, because they knew the condition, the heart defects, and the seriousness of them, so we had to be prepared. And I don't remember how quickly we came to Dr. Gay's office, if it was the day after we brought her home or if it was within the first week, but it was very, very quickly after we brought her home. And a really neat bond was formed.
So in 2009, when she was 9 months old, she had a Glenn procedure where they did open heart surgery and made some corrections. And then in 2011, she had a Fontan procedure, which completed more corrections to her heart. And her heart doesn't function the way a normal heart does, but it works very well for her because of the corrections that were made. And then a final procedure, an interventional cath in 2011, kind of finished up the job and raised her oxygen saturation levels higher than they'd ever been, and allowed her to be active and healthy and happy.
Then after her first open heart surgery at UVA, we were shocked. The change was instant when we brought her home. The photographs from the day we brought her home compared to the day we left, her coloring, everything.
It was such a big difference after the surgeries. I remember she was kind of tired before, and when she smiled, she was just kind of weak. Like, she wanted to smile, but she couldn't really very well because it tired her out. But after the surgery, she'd just smile and kick and play. It was just a huge difference.
Just nice to have her and have her all feeling better, and that she's not like weak like she used to be before the surgery. He's just a sweetie.
Dr. Gay kept in close contact throughout all of our dealings with UVA. He set everything up. They knew what she needed because Dr. Gay told them what she needed, and he kept close tabs on her.
He usually texts me on his heart that you listen to, and stethoscope.
I remember Frank telling her that he said, "You know how your heart, when Dr. Gay listens to it, your heart goes swish, 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 swish. Well, they're going to fix your heartbeat so that when they're done with this, you'll have a heartbeat and it'll go boom, boom instead of swish, swish. I don't know how many doctors call their patients pumpkin and mean it, and how many doctors and nurses that have a patient that talks about them at home and calls them friends genuinely. Dr. Gay and Amy are a very important part of our family and extremely important to Katherine.
The Rays pretty much inspire me, so, you know, as medical people, it's a privilege to take care of families and people that are not well. I think taking care of Katherine and being with their family takes it to a level that it's pretty hard to express. So anyway, I greatly appreciate them saying such nice things, but it's us that are the lucky ones in this deal.